Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about influenza. Is it too late to vaccinate? And our special guest is Lori Schiffauer, a nurse with the Frederick County Health Department. Lori, welcome. Thank you for joining us.
Thank you for having me.
All right, let's get started with what is influenza?
So influenza is a respiratory disease that affects the lungs and is caused by viruses, influenza viruses. Some of the symptoms that you see are a very high fever, some shortness of breath, a cough, extreme fatigue that can last up to a couple of weeks. It's spread by droplets, so that when you cough or sneeze, it spreads into the surfaces in front of you, so you need to be careful about that and keep that in mind.
Okay, well, let's talk about preventing it then.
Okay, so vaccination is absolutely the best way to prevent influenza. Also, hand washing. When you're working with those high-touch areas, you want to make sure that you're washing your hands well. Cough etiquette. So if you do have a sneeze, to cough, have a tissue with you. If you don't have the capability of having a tissue, then in the bend of your arm or can help reduce that transmission of the viruses.
Okay, I know a lot of people think about getting vaccinated in the fall, but so how about for those people who haven't been vaccinated yet this year? Is it too late for them to get vaccinated?
No, it is not too late. There's still plenty of time. We see traditionally the season is from October through May, but traditionally we see more cases in January and February. The thing that people need to keep in mind is it takes a week to two to develop a full immunity, so they need to vaccinate as soon as possible. But it's definitely still an appropriate time to be vaccinated.
Okay, all right. Would you mind talking a little bit about what's in the vaccine and the influenza vaccine for this 2013-2014 season?
Sure. So there are 3 different ways to administer vaccine. The traditional IM injection, and that this season primarily is a 3-strain, so it's 2 influenza A strains and a B strain for coverage. Flu Mist is a nasal spray we've had it out, believe it or not, for 10 years now, and it covers it's called a quadrivalent. It covers 4 strains of influenza, and that's recommended for healthy individuals between the ages of 2 and 49 years of age. There's also an intradermal that gets placed. It's an injection, but with a much shorter needle, and that goes just underneath the skin, and that's recommended for folks 18 to 64.
All right. Well, who needs to get the influenza vaccine?
Everyone needs to get the vaccine, particularly those folks that are more at risk for complications of influenza. So you think about infants less than 6 months of age who are not able to be vaccinated. By vaccinating folks that are around them, their parents, grandparents, caregivers. Folks over the age of 65 who are also more at risk of complications, vaccinating them, and also family members and caregivers, healthcare workers that care for them too. People that have chronic medical conditions that are also more at risk of complications, those folks should receive vaccine also.
Okay, so for those people who haven't been vaccinated yet against influenza, where can they go?
I would start with your healthcare provider and talk with them about it, but we also know that, especially for adults, it's available in the community. So check the local pharmacies, the local big box stores, your Walmarts, Targets, those kind of things are hosting clinics also.
Okay. And then now some people need to have 2 doses. Could you describe who needs to have 2 doses?
Children who are 8 years of age and younger who have never had a flu vaccination before, the first year they're vaccinated, they should actually get 2 doses. And they need to be spaced 4 weeks apart. So, and once they're vaccinated with those 2 doses that season, it's only 1 every year after that.
Okay, all right. Well, I was hoping you might tell me what you say to people when you hear what I frequently hear, which is, I don't get the flu. Why do I need to get the flu shot?
Right.
What do you say?
Well, flu is not particular. It will affect anybody, even healthy individuals. And some of us get lucky and aren't as affected by it. But also, by being vaccinated, we're protecting those folks that the vaccine is not available to, folks that are allergic to it, folks that are under 6 months of age, those elderly folks that have the complications and they don't get quite the robust immune response by healthcare providers, and we being vaccinated, we're protecting them also.
And another point that I often add is some people say, oh, why if I start to get sick, then I'll just stay away from other people. But what they don't realize is that even before they feel the symptoms, they are starting to shed the virus or be contagious.
That's right.
So that's why that act, the personal action of just distancing themselves from others is not effective for influenza control.
And we know that we need to give the vaccine time to start to work. So once they're vaccinated, it still takes a week to before you develop an immunity.
Right. Good point.
So that's why be vaccinated early in the season when you have the opportunity. It's the best time.
All right, well, very good. If people would like more information about influenza vaccination, where can they go?
I would say call your healthcare provider, talk with them about your health status and those kind of things. You can always call us at the immunization program at the health department, and that number is 301-600-3342. You can check our website, which is frederickcountymd.gov/flu. And the CDC is also great for a lot of information about influenza, and that's cdc.gov/flu.
Great. Well, thank you very much. Thank you for reinforcing the message that it's not too late to vaccinate.
All right, thank you.
And now please stay tuned for this month's Medical Myth.
The Frederick Board of County Commissioners invites you to watch live and archived broadcasts of county meetings. Simply visit the Frederick County Government website at www.frederickcountymd.gov and click on the link to watch FCG-TV live or the link for FCG-TV archives. You can also save time when viewing a previously broadcast meeting by locating the agenda topic of interest and clicking on that item. The broadcast will then start at that section. These website tools are designed for the convenience of our viewers and to improve access to county government open meetings. And did you know that you can watch FCG-TV on your mobile devices as well? For more information, visit www.frederickcountymd.gov/FCG-TV.
This month, I'll talk about myths related to New Year's resolutions. A common myth related to New Year's resolutions is that they don't work. Well, that is partly true. For all resolutions, if you are committed to taking action and develop a reasonable plan with realistic goals, then you will be more likely to be successful. For example, a common resolution is to exercise more. That is a great goal. But getting started may be overwhelming for someone who has an image of a spandex-wearing, muscled person spending hours each night at a gym. So setting realistic goals is the key. You may eventually get to that image you have, but to be successful, you may need to start out with a smaller and more attainable goal.
And now here's
like 5
this
minutes
month's
of fast
medical
walking at
myths.
lunch, or 5 minutes of going up and down stairs at work. You won't even need to put on spandex, and it won't take too much of your time from your already busy schedule. You can do it. It is within reach if you are committed and make a realistic plan. A second common myth heard around New Year's is a belief that going on a crash diet will be the best way to get to a target weight. It's natural for anyone trying to lose weight to want to lose it very quickly, but evidence shows that people who lose weight gradually and steadily, that's about 1 to 2 pounds per week, are more successful at keeping weight off. Healthy weight loss isn't just a diet or a program. It's about an ongoing lifestyle that includes long-term changes in daily eating and exercise habits. To lose weight, you must use up more calories than you take in. Since 1 pound equals 3,500 calories, you need to reduce your caloric intake by about 500 to 1,000 calories a day to lose about 1 to 2 pounds per week. Once you've achieved a healthy weight by relying on healthy eating and physical activity most days of the week, and that's about 60 to 90 minutes of moderate intensity, you are more likely to be successful at keeping the weight off over the long term. Losing weight takes more than desire. It takes a commitment and a well-thought-out plan. Here's a step-by-step guide to getting started. Step 1, make a commitment. Step 2, take stock of where you are. Step 3, set realistic goals. Step 4, identify resources for information and support. And Step 5, continually check in with yourself to monitor your progress. Well, one of the most common myths spread by smokers is that they can't quit. The truth is that many ex-smokers used to believe the same thing, and then they tried, and tried until they were eventually able to be smoke-free for longer than they had been smoking. In fact, since 2002, there are more ex-smokers than there are current smokers. You can be one too. Oh, and for those of you who say, I tried to quit before, but I just went back to smoking, you are actually in a really good position to be successful in the future. The experience that you had works in your favor for stopping smoking. You can make your 2013 smoke-free and tobacco-free. There are free classes in Frederick with free nicotine replacement therapy. There is a free 1-800-QUIT-NOW phone resource and support system. And now there is also a text messaging support system to help you be successful in following through with your resolution to be tobacco-free in the year 2013. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Substance Abuse Prevention Unit of the Behavioral Health Services Division. From January 27th through February 2nd, 2014, teens across the nation will celebrate National Drug Facts Week. National Drug Facts Week is a health observance week for teens that aims to shatter the myths about drugs and drug abuse. Getting its start in 2010, officials with the National Institute on Drug Abuse, or NIDA, launched this annual observance to counteract myths communicated to young people through the internet, TV, movies, and music, and to stimulate conversations about drug abuse and addiction based on what we've learned from science. According to NIDA, about 1/3 of high school seniors report using an illicit drug sometime in the past year. More than 10% report non-medical use of potentially addictive prescription painkillers, and more than 20% report smoking marijuana in the past month. Many teens are not aware of the risks to their health, to their success in school, and the dangers while driving under the influence. When teens are given the scientific facts about drugs, they can be better prepared to make good decisions for themselves, and they can share this information with others. Due to recent overdose deaths in Frederick County, sharing the facts about the dangers of drug use is more important than ever. Between 2007 and 2012, there was an increase in overdose deaths in Frederick County. During that time period, there were a total of 134 fatal overdoses in Frederick County. In 2007, there were 22 fatal overdoses, while in 2012, there were 25 deaths. Now is the time to act to prevent further drug use in Frederick County. The National Drug Facts Week website has many activities and ideas to share as you plan activities in your community to prevent drug use. Some ideas include hosting an I Resolve party around New Year's Day, or hosting a football-themed trivia party around the Super Bowl. Invite local bands to play at a drug-free youth event, or host a trivia game with teens against adults and find out who knows more about the dangers of drugs. Visit the National Drug Facts Week website for more ideas, resources, fact sheets, and other exciting items to plan and promote your event. For more information about National Drug Facts Week and ways you can help prevent drug use in your community, contact the Frederick County Health Department Behavioral Health Services Division at 301-600-1755 or visit us online. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.